My name is Brandon Martin Williams. I'm a surgical technician here at Tubal Reversal Center.
My name's Kathy, and I work as a surgical technician at Chapel Hill Surgery Center.
My job here is to ensure a clean and sterile aseptic environment, to sterilize the instruments, and to assist the doctor during surgery.
I'm comfortable during surgery, and one of the ways that we do that is with a local anesthetic, and that helps the patient in recovery room recover with less pain.
Another aspect of my job is sterilizing the tools and instruments needed for surgery. After every case, we roll the instruments out in a small biohazardous box. We spray it down with a disinfectant, and then we almost immediately submerge it in something called an ultrasonic. This is filled with a dual enzyme cleaner, and the ultrasonic shakes around basically to loosen any debris on the instruments. After it has set in the ultrasonic for an appropriate amount of time, we then move the instruments to a sink next to it and scrub it and inspect the instruments ourselves. This is very important because the scrub is inspecting the instrument and looking for any loose materials, any biohazardous materials, and they are themselves taking it off the instrument. After that, we move the instruments to another room where we dry and rewrap all the instruments and count them for next day's surgery.
We have a quiet OR for concentration to focus on the case, and that helps for the surgery to move along more efficiently. And we also try to eliminate a lot of manipulation of the patient's skin tissues, so we use finger retraction, and that way it's less traumatic on the patient's tissues. So when their surgery is finished, they're feeling comfortable in the recovery room, and therefore their recovery time is lessened and they're more comfortable.
In assisting the doctor for surgery, the surgical technician is responsible for handing the instruments to the surgeon. One of the unique opportunities here at Chapel Surgical Center is to actually become a first assistant to the surgeon, and this person stands across from the surgeon and helps with visualization.
I think the fact that we work as a team is probably my favorite part of working here. We all work together to ensure that the patient is taken care of, number one, and we're all a part of that process. And everyone here has a certain job that they do, and it makes for a very smooth beginning and end to tubal reversal surgery.